line dressing change. And the first thing that we're going to do is obviously let our patient know, introduce ourselves, check their ID band, make sure we have the right patient, make sure we have the order to make the change. Close the curtain, privacy for the patient, raise the bed if we need to. Obviously you can see he's a little special patient. But once we explain the procedure to the patient, we're going to go ahead and mask him because this is a sterile procedure. Right now, I just have clean gloves on because the first thing I'm going to do is change his bandage. I have some alcohol wipes here because sometimes the bandage gets sticky, and when you have gloves, it can become a problem. So I'm going to open an alcohol wipe just to have it, and I can use it for around the edges of my previously bandage, the previous bandage. You always want to accommodate yourself, so I move the patient closer to me so it's easier to work. And I'm going to use my non-dominant hand and place it on the line so that it doesn't move around. And I'm going to go ahead and take the bandage off. I'm going around the edges in a circle and just loosening the edges up. I don't want to just rip it off. It's important to have gloves that fit you, according to Linda Mulligan. At this time too, or at the beginning, I can also check the date and time that this one was changed to make sure that, no doctor came in and had already done this. You don't want to do it more often than needed because you can contaminate the site. Okay. Use my alcohol just to help me a little bit around. Once I get all the corners loosened up, I can just go ahead and lift it off completely. Then I don't need my clean gloves anymore, so I have my old bandage wrapped up in them, take the gloves off, and that's garbage. I can also get rid of my alcohol wipes. As I said, this is a sterile procedure, so I will have a dressing change kit, a central line dressing change kit, that's going to be unopened obviously. Being a sterile procedure, inside the kit I'll find a mask. I need to mask myself as well. And the first thing I need to do is take out my sterile gloves and set up my sterile field. So open the kit. And then I have my sterile gloves. Okay. Non-dominant hand first. I'm good to go. I can keep this as a sterile field if I need it, but I don't think I do. I'm going to set up another one so I can go ahead and throw it away. Just touching the outer corners with the shiny side down. That's right. I now have a sterile field. I can go ahead and dump my contents out. All right. I have cleaned the site. I have my new dressing, some additional dressing closures. This is to clean the tube. I have this, tape, and my label. Okay. And I believe the gauze is just to dry the area because, well, you want to let it air dry, but I'm pretty sure the gauze is just to dry the area if you need it. First thing I'm going to do is, I wouldn't reach over my sterile field normally, but just for the sake of this, I'm going to move my patient. First thing I'm going to do is clean around the site in a circular motion going out for 30 seconds. And you just clamp this to let the solution out, and you're going to vigorously clean around in a circular motion. Again, for about 30 seconds. Okay. This is now garbage. Next, I'm going to open up my swab and I want to clean the lumen. And we're going to clean from top to bottom, starting here, going down, and all around the tube. For the sake, I'm not going to open it. I'll just open one of these. That's just so we can reuse it later, but. So I would open that up, again, holding the tube in place because it can easily be moved. I'm going to clean down, 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 and throw this away. Okay. This all needs to be dry before you apply. So if for some reason it's taking too long, you can use this, but you don't want to wipe it or anything. You can just kind of pat it dry. And then discard. Okay. Next, we're going to apply the dressing. And we'll take off like so. You can see that there's a perforation for where the new tube goes. And I believe you want to put it directly in the middle.
So you can see it.
So you can see the tube, and then that goes down. You want to make sure there's no bubbles, it's nice and good. Like that. And then we're going to take off I actually can take my gloves off at this point. It helps. It's not sterile anymore. It's covered, so I can take my gloves off. I can put clean gloves on, because anytime you're touching the patient, I could put clean gloves on, or I could just do it like this. I believe in class, you just did it like that. There we go. Okay. Don't need my mask anymore. I don't need a sterile field anymore. Everything else is garbage. I have my label here. So, date, 5/2, time, 1 o'clock, name, Nurse Russo. Label. Throw away everything. Let my patient know he's all set, and I can come back and check it next round.
Okay. Okay, thank you.